it comes to handoffs, and that's particularly between our GP population and the acute sector. So at some point I would like them to come back to demonstrate to us as part of that £1.1 million investment how we are going to better manage that. I mean, Chris knows that, you know, I've brought a number of cases to his attention where somebody has presented with multiple morbidities. The GP has said, see ya, you're in the acute sector, you know, let me know how you get on next Christmas, and left the individual wandering around what is a very complex organisation. I am concerned that I don't think there's enough GP engagement supporting patients in the hospital system. And as evidence of that, we had the shocking scandal before the current management team came with the waiting lists, the 3,500 oncology patients and the 3,000 orthopaedic patients whose referrals were mislaid within Imperial. That's been fixed. But that was brought to light through a PCT and Imperial owning up. There was not an army of GPs screaming the place down saying, why the hell isn't my patient being seen? So I think, you know, this is a very big issue. That if we are going to invest that much taxpayers' money, we need to make absolutely sure that we've got seamless transition and we've got continued support so that we can achieve the sort of world-class patient outcomes that we all hope for. Somebody want to answer that?
Susan,
I acknowledge what you're saying. I think it is, we are driving the message home to GPs repeatedly of their responsibility in terms of supporting patients with referrals into other providers, making patients aware of how long they should expect to hear before they hear from the trust, what kind of appointment they should expect. We've done a lot of work with the Trust about trying to improve communications between ourselves and them in both directions, and have some quite specific plans in place to try and improve those kinds of communications. And just as a GP, I think we have made significant advances in that already. So hopefully, we acknowledge what you're saying, and I think there are improvements in training to try and produce better results for people in that kind of logistical sense.
So perhaps we could see a plan at a future meeting. I'm particularly concerned about vulnerable people, people with learning disabilities, vulnerable elderly, because they, again, you know, it's intimidating enough when you're launched into a system. If you can't, you know, present your case eloquently, you know, and it can be very distressing for them, then it's a real issue. So I think if we could see actually some hard evidence in terms of what you're doing and some measures put in place as to how it's going to improve and how it is improving at one of our future meetings in the near future, that would be very helpful and might help underpin your £1.1 billion ask.